Hi, I'm Ken McLeod. I'm the Policy Director for the League of American Bicyclists. I want to welcome you to this response webinar today. I think this is one of the more positive stories that I've seen in this coronavirus crisis, to see the way that advocacy groups and bike share operators have been responding to get bicycles in the hands of essential workers so they can continue getting to work, continue to provide services for people, and do so when transit service has been cut or other things are making it difficult to get to work. So we have two great presenters today. I want you to use the chat box in the probably right-hand controls panel to ask lots of questions. I hope you are inspired by their presentations to pursue similar efforts in your communities, to really help people who need transportation use bikes for transportation during these times and going forward. So with that, I want to welcome Danny Harris, the Executive Director of Transportation Alternatives, bicycle, pedestrian, and transit, everything but cars advocacy group in New York City. And Colin Hughes from Jump Bicycle Share, which is a bike share company that operates with fleets of e-bikes and scooters in cities throughout the United States. They are owned by Uber and have been around for a couple of years now. These two presenters are really doing the great work in cities. And I am going to hand it to Danny Harris to talk about transportation alternatives work with Bike Match to start us off.
Great, thank you, Ken and Colin, and I hope that this is finding everybody safe amidst these challenging times. I'm honored to be the Executive Director of Transportation Alternatives and really wanted to use this as an opportunity to talk a little bit about our Bike Match program. So Colin, can you guys see me okay? The presentation?
For some reason, it's showing up as like a half screen slide.
Okay.
I'm not sure I've seen that before.
Okay, well, so it's half me and half the presentation?
It's just like a much smaller slide that takes up half the screen.
Okay, well,
it's still legible.
Okay, great. So let's move on then. So I'll just sort of walk through some of the things I'd like us to address today and really open it up for a set of conversations with the group. So I just wanted to give you a brief background about transportation alternatives, talk a little bit about how we have stepped in moments of adversity over time, and then talk a bit about the immediate program of Bike Match and what opportunity we saw. So just in short, Ken gave a brief background, but you know, our focus is really to advocate for better walking, biking, and public transit for all New Yorkers. And you know, I think in many ways, as I'm sure you're seeing in your cities now, this is really the opportunity where none of us wanted this pandemic to happen. And at the same time, residents are starting to see what their city could look like without cars. And I think most importantly, how much of our space is wasted on cars. So, you know, we know that in a place like New York, about 30% of our city is wasted on cars and car infrastructure. And, you know, roughly about 80% of our public space is devoted to car and car infrastructure. So in short, the equation that we're trying to solve is a pretty simple one. It's infinitely complex to get to, but space minus cars equals quality of life. And within that equation, we know what is static and what is dynamic. And the quality of life indicators are many, which I'm sure those on the call know about, but you know, I would just sort of draw your attention to a few. There was a Harvard study that was mentioned just I think 2 or 3 days ago in the New York Times about looking at the intersection of air quality and coronavirus and the impact that pollution, especially car-based pollution, has had on communities and the current impact. And I think the report suggested that there were, I think, almost 280 plus people who they could have tracked as being their coronavirus condition being associated with poor air quality. So, you know, I think depending on the circumstance, we can always sort of drive the challenge of what cars are doing to our city. And I think now Again, it's sort of tangential, but we're seeing that cars continue to impact our city every single day, in the good days and worse in the bad. So we've been around for about 47 years and have really been on the front line of everything from, the first creating the first protected bike lanes in the US, bringing Vision Zero to the US and to New York. And then we've helped to support about 1,000+ miles of bike lanes in 70 public plazas. Most recently, we've been on the front line of bringing congestion pricing to New York. Obviously, it's in a bit of a challenging state now, helping to launch the People Way in 14th Street, which is now being modeled in San Francisco on Market Street. Streets Master Plan, which is going to bring 400 miles of protected bike and bus lanes by 2026. The largest speed camera program in the world. And just recently, we launched the first program that targets reckless drivers with restorative justice. So if you get over a certain threshold of red light or speeding cameras, you have to take a course or your car will be taken away. It's the first in the nation, and we're excited to grow it and pilot it here. So obviously all of these things are driven by both, getting the city to where it wants to be, but many of these things were unfortunately driven by the incredible amount of death and destruction that cars have brought across our city. Where we've sort of stepped up and seen opportunities over time is, on 9/11, during a transit strike in 2005, and during Hurricane Sandy in 2012, where TA and our activists really mobilized to try to find opportunities, whether it was how do you give more access to cyclists on key roadways and bridges, whether it's when the transit strike hit of how we could use bikes. We had a campaign called Bike the Strike, which encouraged people to ride together to get around our city. And then in the aftermath of Superstorm Sandy, it was actually cyclists and cargo cyclists who started using their bikes to transport goods and essential items out to the far Rockaways. So in each of these things, we've looked at, what's the moment that's playing out in our city? How can we be relevant? How can we support our city? And how can we respond to what's happening immediately, knowing situations will change over time? As coronavirus started to play out in New York, and we're seeing that the numbers continue to grow, we asked ourselves that same question set, and we looked through a few options where we could be immediately impactful. So the first is we looked at open streets, given the needs for physical distancing and how small New York City sidewalks are. We put out an immediate call for an open streets program. The mayor and the DOT responded with a minor pilot of 1.6 miles, which they took away after about 10 days. The weather wasn't great. It's over-policed. It wasn't done the way that any of us wanted it to, and so we're continuing to advocate and push for more open space in our city. Emergency bike lanes, we work with DOT to put up at least 2 immediate protected bike lanes, one on 2nd Avenue in Manhattan and one on Kent Street in Brooklyn. We're going to continue to expand that as well. We worked up in Albany. We've been working for a number of years to legalize e-bikes. There are 40,000 delivery cyclists in New York. They're now frontline workers. Their tool was illegal, so we worked with the governor to have this be legalized within his budget statement that passed just a couple weeks ago. And I think most relevant to this conversation, our art director, Jay Oberman, had an extra bike lying around his home, and he put it up on social media, and it quickly found somebody that day. And his idea really became the inspiration of a broader campaign for us, which was, how could we reach out to our thousands of members who might have an extra bike and give it to a frontline worker? So that was really the inspiration of Bike Match. And since then, I'll talk about the numbers in a second. But it's really grown, and it's really targeted on the people who need it the most. And these are people who are volunteering in their neighborhood, people who are nurses or doctors or other frontline workers, and also those who need to use it because they still have to work, but they're scared about taking public transit. The concept is incredibly simple. We created a Google form. If you have a bike or need a bike, you post your have or need. You talk about, where you live, tall, your height, where you live, and then we actually have somebody on our end who makes that connection. And then we asked everybody to abide by CDC guidelines about, cleaning the bike and making the trade at a place that's safe for everybody. And then what we also did was we open sourced our platform. So anybody who was interested around the world could launch it. And, you know, basically our numbers right now, we've been up for just around 2 weeks, is we've had about 400 bikes donated. We were really fortunate. We had a few big bike sponsors who came in and wanted to be a part of this. And so they helped to fuel our growth after we started to get some national attention around it. We've had 250 people sign up for the program, either who have a bike or need a bike. We've made 55 matches, and we've now helped launch 2 offshoots, one in Washington, D.C., one in Tel Aviv, and we have a list of at least 10 other cities that have expressed interest in launching it. So, you know, for us, I think what we really saw was, again, not just how we can be relevant in this moment, but, you know, bikes, we've always believed are part of critical infrastructure. And now, you know, we're seeing it open huge opportunities for the bike community to, you know, have closer relationships with hospitals, with unions, with transit workers, sanitation workers, you know, all the people who are on the front lines and have to work now. We want to make sure that we can offer a safe tool. And I think over time, we'll continue to grow it, both in terms of getting it to more communities in New York, and we're really eager to help more cities launch their own. Again, it's completely open source. We just have a hashtag bike match, and you know, we're really eager to get into the hands of more people who are on the front line and do need a tool to get there. So if you're interested in learning more, this is the information on our website is transalt.org/bike match. And if you have any specific questions, you can reach out to me. My email's on the bottom. It's danny@transalt.org. And with that, I will turn it over to Colin. Thank you.
Yeah, thank you for sharing that. I'm really excited to see this hopefully spread to more communities, because it's just such a cool story about getting bikes to essential workers. And I think it's going to be a need that's going to continue as this crisis continues to go forward. People need a way to get around, and you know, I believe bikes are one of the best ways to get around.
That makes 3 of us. So really great presentation from Danny, and I've been just really impressed with what TA's been doing in New York over the last couple of weeks. I've been following, you know, a lot of the statements that they've been making in the press and the awareness they've been building around the needs for infrastructure. Really loved how they were addressing this from, you know, looking at not just doctors who need to get to work, but also the people who are delivering food, who have up until recently had, you know, not a lot of representation. So I think that's just a great model, and it's awesome to see, you know, advocates like them doing such a great job. So I'm going to talk a little bit about what we're doing at Jump Micromobility. You can go to the next slide, and we've been looking at, you know, what's happening with the COVID-19 pandemic, and then what our response should be. And I'm going to kind of talk about, we developed a framework internally to think about this. And really, first I'll talk about how we're responding operationally as a mobility provider. And, you know, that started with, as we saw this ramp up, we, you know, now that we're a part of a larger company like Uber, we have some more resources. We have an epidemiologist that consults for us. And so we saw this coming very early on. We realized that if the pandemic grew, that we could be looked at as an essential service provider. And so we got really busy right away thinking about how we're going to support cities, but also how we can do that safely, both safely to the community and to our own employees. And so first off, when we're working with cities, we're taking it really on a case-by-case basis. Something that's been interesting and maybe surprising to me at first is, even though every city around the globe is dealing with the exact same root problem, this single virus, the responses that cities are taking are wildly different. And so, you know, on the same day in the same state, we might have one mayor reach out to us and, you know, ask us to shut down operations swiftly. And because they're worried about the bikes being a vector, the shared bikes especially, I think, or scooters being a vector for potential transmission. So that's happened in some cities. And then we'll have, in the same state, same day, we'll have another mayor reach out and deem us an essential service and explain that as they shut down transit service, they really want to see JUMP, which is, you know, it is a shared vehicle, but it's generally considered lower risk than transit, where you're in the same vehicle and airspace as mass transit vehicles. So JUMP is looked at as less risky, or micromobility is looked at as less risky than transit. And so we have cities, you know, asking us to please keep operating. Where we're asked to keep operating, or where we're able to, we do. And we're operating in about a dozen cities still in the US, several in Europe, and still operating in Mexico City. And what our team did when we realized the risk, kind of starting back in when we started looking at this in February and operationalizing in early March, we created a video that walked through for our hundreds of employees how we are going to sanitize vehicles and to make sure that they're safe for customers every time we charge them, but also all the processes to make sure that our team working in the warehouses and out on the streets is also keeping themselves safe. And that, you know, we needed to get that in place right away to make sure that we could continue to operate, and you know, our own team didn't get sick, or that we didn't also become a vector for transmission. And of course, we are also still suggesting that anybody who uses JUMP, number one, we're saying don't use JUMP unless you need to make a trip. That's number one. And then the next steps are, if you do have to make a trip, wear gloves, wash your hands, and sanitize the contact points of the bike before and after use. And we just want to make sure that everybody's safe. You know, we have seen some interesting, different people are saying that micromobility and bikes might be safer because they spend so much time in the sun, and the virus doesn't last very long in the sun, but we're not taking any chances. We'd like to see everything sanitized as much as possible. Another thing that we started doing in our planning phase as we were preparing was looking at the service areas of where we offer JUMP in cities. Because we have a dockless technology, and we have, you know, our service area isn't physically installed stations, it's simply a geofence that we can redraw literally in a few seconds. We got our urban planning team to start looking at mapping essential services, medical facilities, grocery stores, pharmacies, and we started looking at how we could shrink some service areas to make sure to focus the service around those essential services. And then we also started changing our deployment patterns, where we put the vehicles after we charge or maintain them, to make sure that they were focused on those zones. So that's kind of the operational viewpoint. And if you move to the next slide, I'll talk a little bit about just, you know, that's what we're doing as a company operating bikes, but we're also, you know, we're a part of a city's mobility infrastructure, and really we're, you know, just as citizens, we also wanted to have a civic response to address the virus itself and help cities be resilient. And so we started right away. All our local teams were talking to city governments and in some cases medical organizations in their city, and starting to set up small partnerships. We all got together, we looked at some of the opportunities, we we looked at what was working, we turned that into a global program to give free JUMP rides for essential service workers. And we do that at an employer level. So if you're an employer who runs a business that's considered essential, you can email us. We've got a blog up on the JUMP website, the JUMP Medium post, that explains how you can get in touch with us. And we can send you a code that all your employees can use for at least 20 free 30-minute trips. And that's everywhere we're operating around the world. In a couple places like Berlin, we stopped operating at the city's request, but then we found that there was a need in getting people to one of the largest hospitals, especially for staff. So we've given that hospital its own private fleet of bikes. And so the staff there can use the bikes. No one else in Berlin can. And we can't necessarily do that everywhere. Kind of has to be the right mix of the right situation. But in Berlin, we're able to do it. And so we are. And then all that's, you know, a part of a larger Uber campaign where we're giving 10 million free rides and deliveries. I think what's interesting here is also the way that we communicate with customers. You know, as a company who moves people around, we had to communicate to our customers that they shouldn't be using us for that purpose. And so Uber has a campaign that Jump is also pushing out that's just called Stop Moving, and it focuses on only moving if you really need it, but using delivery services and things like that for anything that doesn't require actual movement. And go to the next slide. Here's the framework that we've been thinking about as we have built up our civic and operational responses, and we're still kind of working here. And I think maybe for some of the people here, this is also could be a helpful way for you to think about it. If you're working for an advocacy group or a company in the space, we just looked at the COVID-19 crisis as having 3 phases. There's going to be a preparatory phase where we needed to decrease mobility, decrease transmission, a peak phase that would be focused entirely, and we're kind of, I think, approaching the peak phase where it's focused entirely on just making sure essential services can stay up. The essential services will be under critical strain. So how can we support that? And then, and so that's kind of our interventions to date have been mostly focused at those 2 phases. What we're really starting to plan now, and what I'd be really interested to hear ideas around, is what we're going to do, how we're going to support cities and our communities in the recovery phase. And that's going to be a recovery in terms of public health, but it's also going to be one in terms of public services. The economic crisis could last a year or more that results from this, and that's going to probably result in mobility gaps. And we're looking at ways we can, step in and support cities and communities there, and that's kind of what we're designing now. And and you can go to my next slide. And I think looking forward, I think most of the people on this call probably always known that bikes and micromobility in general is resilient mobility, and it's complementary, and it's a redundancy to public transit, and that's affordable, it's sustainable. And so what I hope is, as we look forward, right now I think people are understanding, especially in large cities, the value of having these complementary and redundant systems, and hopefully we can capitalize on that. I was just reminded of, I just tweeted this out if anybody wants to look at it, but 13 years ago I was a student in urban planning, and I wrote a term paper on the history of the bicycle in American cities. And what I found in this analysis of looking at the bicycle's huge rise around the turn of the century and then decline as the automobile started to dominate roads is that was the trend. It went up until about 1910, and then bicycles dropped, except in times of crises. And so when you look at the Great Depression, when you look at World War I, then the Great Depression, then World War II, the gas crisis of the 70s, you saw massive spikes, not only in people riding bikes, but in government also supporting it with infrastructure. So this isn't the first time that New York City has had temporary lanes. I talk about that a bunch in the paper. This isn't the first time we've seen government step in to build bike parking so that workers can get to essential services. So this has happened before. And I think what I hope as we look forward to coming out of this is that this isn't a temporary thing where bikes and micromobility surge while resources are scarce. I think resources are always scarce. We need to be much more mindful of how we use them. And so when gas prices, when the economy gets better and things, that people don't just start kind of being more wasteful or using more inefficient, unsafe means of getting around. So I think there is an opportunity here to show the value and hopefully to lock it in so that we are stronger the next time we're faced with a crisis.
Yeah, thank you for that. That's great context. I've also been looking back to history, trying to see what happened after the recession in 2008, 2009, where it took people a while to get back to jobs, and we kind of saw peaks in bike commuting in various cities 2 to 3 or 4 years after that financial crisis, because bikes are such a low cost, affordable way to get around. They just are great in a crisis. They're great anytime, but people especially find them useful in a crisis. So I want to encourage more people to ask some questions while we have Colin and Danny here. The first question that we got is for Danny, and it's about whether there are any liability issues with Bike Match. Do people sign a release waiver? Is that a concern?
It is a concern. There were a lot of lawyers before, and there remain a lot of lawyers now. And so we put together a liability form that we're happy to share. It should be on our on the Bike Match website as well, so that once you do go in the form, it's something that you get and you have to sign. And that's boilerplate language. So if somebody wants to adopt it for their community, they're welcome to do so.
Okay, great. And I was also wondering, like, in terms of those partners that donated bikes, did they find you? Did you search them out? If I'm at another organization, are there suggestions for people you might reach out to?
I would say there are a number of them. The first is that there are, in many cities, there are already local bike rental companies, some of whom have older bikes that they may not be using anymore. So we were really fortunate. We had a great local partner here that we'd worked with before who donated 60 bikes to Bike Match. And then we were fortunate, we were in a NPR All Things Considered story. And because of that, we had a bike brand that'll be announced on Monday reach out and offer us 200 new bicycles and a commitment to help grow this around the country. The other things that I would suggest is, depending on where you live. I mean, for example, we live in a city, and a lot of buildings here have bike rooms, and a lot of those bike rooms have bikes that aren't used. And so there are, no shortage of ways that we've been thinking about of getting additional bikes. So we've reached out to building management companies to ask if they have bikes in their lost and found. We've reached out to local community groups, even to older adults who may have a bike that they don't ride anymore. Families that might have a kid who's no longer at home and may not need the bike. Especially in a place like Manhattan where space is so small, we didn't expect that people, although many of us bike advocates do, we have more bikes than people in our home, but we're probably more the exception. So yeah, we were just looking creatively of where we could find bikes anywhere, and now we're at a really interesting point where we have more bikes. Because I think when we initially launched it, we thought, well, we imagine we're going to have a lot of demand, but not a lot of bikes. And depending on your market, you may find one way or the other. And I think what I would encourage is you find a source or two, and then you also find a potential recipient. So, my brother's a pediatrician, and I reached out to him to spread the word around his hospital. And, we're also reaching out to unions and to hospitals and, other organizations that have direct connection with some of these frontline workers.
Yeah, that's very cool. And some great ideas there for people in terms of finding bikes. I wanted to ask a question to Colin. Are you seeing other bike share providers do similar things? Like, are there now best practices for the sanitation around bike share? Are people feeling relatively confident about that type of thing?
Great question. And I was actually just on a big industry call with the North American Bike Share Association talking about just that. So I think that what we're seeing is, yes, I think all the bike share companies, all the kind of companies involved in this space are really interested in finding ways to help. And so, Lyft, which runs City Bike, and a number of the other large dock-based systems, they also have a critical worker program where they're, providing discounts and trying to get access to people who need it for essential services. I think all the companies have increased sanitation of the vehicles. And, we talked about, we think the critical places to sanitize are the contact points, definitely the handlebars. But if there's a lock that the user has to use, also that, and then the seat isn't a bad place also. At Jump, we actually sanitize the whole vehicle every time we touch it, just to be safe. We'd rather be safe than sorry. I think that's the direction most of the companies in this space are taking it. And I think, the industry as a whole, micromobility, really wants to help cities and is looking to just, do the best things they can. So I think we're all open for more solutions on how to do that, both the civic response and the operations response. And yeah, there's a lot of like really productive conversations like this one happening on that industry side. Oh, and we do always, and then everybody's also, we talked a lot about the communications, like how we urge people to use the bikes and the scooters, and kind of settling on the tone that, right now this should really be for essential trips, especially I think on a shared vehicle, and then just, urging people, making sure people know they still, even though we're sanitizing the vehicles as frequently as we can, they should still be taking full precautions.
Can I just add one thing to that? So I really inspired by, Colin, the work that you and others were doing. We put out a post that actually just landed maybe within the last hour on Medium that talked about all of the resources that we've been able to find both in New York and around the country that are providing free transit service to frontline workers. So, between programs that are trying to collect Metro cards in New York to, free Uber rides. So if that's a helpful resource, you can find it on Transalt's Medium post.
Awesome.
Yeah, and you guys do a lot of great Medium posts. It's a great thing to follow. Got some more questions coming in, so that's great. Definitely want a lot of questions here. One is kind of, these programs can kind of sound like programs that existed before COVID-19 in terms of subsidized or free rides for low-income people and bike share, or like bike co-ops giving bicycles to low-income or unhoused individuals. So we've been focusing on essential workers, but is there any attention still being given to those populations who need transportation during these times? Is there any prioritization of those folks in either of these programs?
I can jump in first. I think that's exactly right. And I would say, at least in Washington, D.C., we're seeing that our African American community is having, being hit much harder than the rest of the city. So I think it is really important to be mindful of the different communities here. So at Jump, in terms of low income communities, we have a boost program that's also a global program. So that's a low income. If you can show that if you can email us anything from a government assistance program that is income based for entrance, then we'll give you entrance to this low income program where currently it's $5 a month for a free hour of usage a day. So that's an ongoing program. And I would say this crisis has brought about new needs in some ways, but in some ways it's just kind of, it's a lot of the same things. It's just kind of like made a lot of existing needs more critical. And so a lot of what we're doing, I think, is not necessarily all new programs, but it is just kind of trying to put more effort and focus in a time where the same needs are just kind of higher.
Yeah, I would agree with that sentiment. Bike match, whatever people need a bike for, we believe that they're able to express whatever need, and we do our best to find a bike that matches. So, while we are obviously providing bikes to frontline workers, we have people who are reaching out because they need a bike to get to a food pantry or to go visit an older relative. So, we put it up there, and we don't make a judgment about what their need is, and we also don't follow up with them a week later to ask them whether they use the bike for that purpose. If people need a bike, it's there for them.
Yeah, that's great. And bikes can continue to be that great source of transportation for people in times of need. In terms of the bike match bikes, are they generally donated and do they go through a maintenance process, or is it more connecting peer to peer?
So we have a basic set of requests. So we ask that the bike be that it's not a bike that requires maintenance to ride, so that someone can immediately jump on it. And then we ask that the original owner that they take precautions like cleaning the handlebars and any of the other sensitive areas. And then once we make basically the role that TA plays is we came up with a form, we came up with a liability, and then we email the individuals to make the match. Where they make the match is up to where they make the connection is up to them, and then we put in a set of recommendations for the new owner of the bike of how they should also clean it before they use it. And we also have another Medium post that we put out was all of the open bike shops during coronavirus. So we also wanted to find a way to support local bike shops. So for people who do need those resources, we provided to them about where and how to get their bike fixed. And also, there's no shortage of materials about how to bike safely around New York. We wish we could build the protected bike lanes that go along with it, but at least we can provide some best practices.
All right, that's great. I think we just have one more question, and that is maybe transitioning to providing those safe places to bikes, to bike. So regarding that Open Streets initiative in New York City, how did they do that poorly, and what would you have liked to see?
Well, I think New York has really been on the front line of so many things that relates to bike infrastructure, Vision Zero, congestion pricing, even sort of thinking creatively about speed cameras. Still, New York over relies on policing as it relates to our Vision Zero and also our Open Streets program. So, like if anybody else on the call has been to some of the open streets in places like Bogota or Guadalajara, it's largely a piece of tape that runs across the street to signal to drivers that that street is closed. Here we remove tape and we put 2 police officers at every intersection. So, the pilot that we had here was, I think, 8 blocks, and it required about 80 police officers. So it was very resource intensive, and part of it was, individuals that were required to open the street to people, but also to, enforce physical distancing. We immediately suggested a set of alternatives about how to do it cheaper and with a reliance on more community support. For example, New York, as I know in DC and a number of other cities, has a long history of block parties and block associations who, have a track record of getting the permits, of closing the streets down, and also of maintaining them with, a sawhorse or set of cones. Business improvement districts, volunteer groups like Transportation Alternatives, even crossing guards who, with our schools closed, many of them are still out because of, the school lunch programs. So there's no shortage of other resources that our cities could be relying on to open our streets to people. It requires creativity and a bit of trust. I think right now our cities are telling residents, we trust you to make the right decisions because we're not forcing you to shelter in place. But still, they're not trusting us to take agency over the streets that we live on so that our kids can be out playing or we can ride our bike without fear of speeding. And just the last point is, as I'm sure many cities are seeing, and Colin, I'm curious if you're seeing it in DC too, but our traffic has gone down precipitously and the speeding has gone up exponentially. There was just a New York Times article that is listing the metrics of the number of speed cameras we've received in the last month have been much higher than last month, given the fact that very few people are driving. So it is open season on our roads, and it's unacceptable. So our cities really need to be doing a better job of putting vulnerable users first, and obviously open streets is a small part of it, but it again is that invitation for residents to take ownership over their streets instead of some guy in a $750,000 Porsche wrecked his car racing on 11th Avenue yesterday. That's what we're up against. And so we have to fight with our city just to, get table scraps. for 8.6 million people.
Yeah, and so many cities have seen that decrease in traffic. I think far too few cities have those red light programs and speed camera programs that give them that sense of increased speed that I think people are seeing anecdotally, but not every city has those programs in place. There's a dozen or so states where it's illegal to have those speed cameras or red light cameras. And that really hamstrings the ability to understand what's going on our streets in a time like this.
Yeah, I'd be hopeful that, I mean, maybe now is a time to be making a better case for that, because, I think everybody understands that police have more important things to do right now than just chase speeders. And also, I think people are feeling maybe are understanding just the concept of vulnerability a little bit better right now, and understanding like, hey, like this is a rule, speed camera. I mean, I'm constantly bewildered by why speed cameras are so controversial, since all they do is, enforce existing rules and improve safety. Might be worth also kind of talking a little bit here, like we've been talking with our city partners. I think mobility is probably going to change a little bit coming out of this. We've been looking at everything from Uber's, maybe to some people's surprise, has actually been a strong supporter of congestion pricing around the country. We were just talking with our policy team, and they were saying they thought maybe some of the pushes we were making on congestion pricing are going to be more difficult now because their congestion will go down for a while. And so how, as cyclists, do we make sure that any decrease in congestion that comes from this health crisis or the economic crisis that seems likely to follow, that decreases in congestion are hopefully taken advantage of, and we can use that. We can use the openings of the openings in our streets and maybe in the political moment to get better infrastructure, to have speed cameras. There's a cute kid. That's the generation we're looking at now. Yeah, and then also there's going to be a lot of service gaps in public transit. Like I've had some really, I've talked with some really scared city officials about new budget shortfall projections. So hopefully bikes can help fill that gap. But I think it's going to really take a lot of the advocates, a lot of the people on this call, and hopefully, industry like Jump and Uber can be a strong partner in that to make sure cities think about that and to get it on the agenda. Any comments from the little one?
They have very strong feelings about a lot of this, as you can hear in the background.
Yeah.
I just have one totally unrelated thing is I have one of the things that I've really appreciated about this crisis is that it humanizes everybody. Like I've been on calls with funders whose kids run through, dogs jump across the screen. You see where people live. So, that I guess that guy who gave the BBC interview and his kids ran through, he was really sort of
he's everyone now.
He was the OG of this world that we're living in now. Yeah, those are my kids. I have a 1-year-old and a 4-year-old.
They look very happy, or the one I saw did.
What else could they want? Their parents are around 24 hours a day. They think it's a vacation.
Yeah. So we don't have any more questions. If you want to give parting thoughts, that's very cool. I hope all the attendees have taken some inspiration from this webinar about getting bikes in the hands of essential workers, and hopefully, as we move through this crisis phase and into the recovery, we'll creatively deploy bikes as the great transportation solution that they are, and we'll see cities and people embrace them more and more. Oh, one last question. Is Bike Match permanent? Are they gifts or are they loans?
They're permanent. They are gifts. People don't need them. They can, pay it forward and gift it to somebody else, but it's on them.
Cool. Any parting thoughts? If not, thank you so much. I thought this was great. I'm really excited that we keep having these conversations, and really excited to see how the advocacy community responds.
And my only parting thought to those on the audience is, beyond staying safe and taking care of those around you, is this is, I think, as Colin had talked about, this is an incredibly challenging moment for our world and an incredible opportunity for our work in cities. One outcome of this is that people say, well, people are going to be concerned about jumping back on public transit and more people are going to buy cars or maybe leave cities. I think it needs to be just the opposite. I think biking needs to be embedded as critical infrastructure that all cities need to have, and that we need to do a better job of weaving that story, that not just bikes and public transit helped us to get through the process. And if some of you saw Transit Center put out a report that I believe that there are right now 2.8 million essential workers across the country that are basically helping to keep our nation moving right now, and about 36% of them ride transit. So, these are critical tools that are moving people that we need the most. And as our nation, we're great at celebrating heroes at the moment and then forgetting about them shortly thereafter. So I think this is a moment where we really need to celebrate the heroes of infrastructure as well, the bike and the public transit network, and make sure that we're, as Colin had suggested, we're thinking through this opportunity about federal stimulus dollars, infrastructure bills, and also really building broad swaths of coalitions. This is about climate, this is about public health, equity, about economic development when our cities come back online. So beyond just the immediate opportunities, I would encourage people to think big and look at broader coalitions across cities of what this moment could really mean for our cities.
I don't think I could say that better than Danny. So those are great parting words. And I'll just say thanks very much for having me and for all the work that the advocates are doing out there. It's incredibly important.
Yeah, thank you both. Thank you for great presentations, inspiring words. I'm excited for us to keep hosting people and keeping conversations going for advocates, because we're going to need a lot of advocacy moving forward if we're going to make those big goals and big ideas happen. So thank you, Danny. Thank you, Colin. Thank you, all attendees. Stay safe, be well, and let's keep biking.
All right, thank you, everybody.
Take care, everybody.